Welcome back to the Vibrant Health Project. Today, we're tackling a topic that's been making headlines: the recent surge in human Metapneumovirus, or HMPV cases. This isn't a brand new virus, but its recent resurgence has many feeling concerned and unsure about what to expect. Similar to the flu, or RSV, HMPV is a respiratory virus that typically causes mild cold-like symptoms. However, it's crucial to remember that for some, particularly those in high-risk groups, HMPV can lead to more serious complications. In this comprehensive guide, we'll break down everything you need to know about HMPV, empowering you to protect yourself and your loved ones. We'll explore the virus itself, delve into common symptoms, and pinpoint who's most vulnerable. We'll also examine the current spread of HMPV and, most importantly, equip you with practical tips to minimize your risk. Knowledge is power, and understanding HMPV is the first step in staying healthy. Let's get started. Human Metapneumovirus, or HMPV, is a common respiratory virus that was first identified in 2001. Although relatively new to the medical world, research suggests it's been circulating among humans for quite some time, often mistaken for other respiratory illnesses. HMPV belongs to the same family of viruses as the respiratory syncytial virus, or RSV, another common respiratory infection. Like RSV, HMPV primarily affects the respiratory tract, causing inflammation and irritation in the lungs and airways. This inflammation is what leads to the troublesome symptoms associated with HMPV infection. While anyone can contract HMPV, it's particularly prevalent among young children, older adults, and individuals with weakened immune systems. Similar to a common cold, HMPV spreads through respiratory droplets released when an infected person coughs or sneezes. Transmission can also occur through direct contact with contaminated surfaces. Understanding the nature of this virus is crucial in recognizing the importance of preventative measures and seeking timely medical attention when necessary. In the next section, we'll delve into the telltale signs and symptoms of HMPV infection. Recognizing the symptoms of HMPV is crucial for early detection and management. While HMPV often presents with mild, cold-like symptoms, it's essential to be aware of the potential for more serious complications, particularly in vulnerable individuals. The most common symptoms of HMPV infection mirror those of the common cold and include a runny nose, cough, sore throat, and fever. Other symptoms might include congestion, headache, body aches, and fatigue. These symptoms typically appear within 2 to 5 days after exposure to the virus. In infants and young children, HMPV can sometimes lead to more severe respiratory issues, such as bronchiolitis or pneumonia. Signs of these complications include difficulty breathing, rapid breathing, wheezing, and a bluish tint to the skin. If you notice any of these symptoms in your child, it's vital to seek immediate medical attention. Remember, early detection and appropriate medical care are key to managing HMPV infection and preventing complications. Staying informed about the symptoms and seeking timely medical advice can make a significant difference in ensuring a speedy recovery. Who's most at risk? Identifying vulnerable populations. While HMPV can affect anyone, certain groups are more susceptible to severe illness and complications. Understanding these risk factors is essential for implementing targeted prevention strategies and ensuring these individuals receive adequate medical care. Young children, especially infants under 6 months of age, are particularly vulnerable to HMPV. Their immune systems are still developing, making them more susceptible to respiratory infections. Additionally, their smaller airways can become easily inflamed and congested, leading to breathing difficulties. Older adults, particularly those over 65, also face an increased risk of HMPV complications. As we age, our immune systems naturally weaken, making us more susceptible to infections. Chronic health conditions common in older adults, such as heart disease, lung disease, and diabetes, can further compromise the immune system's ability to fight off the virus. Individuals with weakened immune systems, regardless of age, are also at increased risk. This includes people with HIV/AIDS, cancer patients undergoing chemotherapy, and transplant recipients taking immunosuppressant medications. By understanding these risk factors, we can better protect vulnerable populations and ensure they receive timely medical attention when needed. Tracking the spread. Where is HMPV hitting hardest? Like many respiratory viruses, HMPV tends to circulate more widely during specific times of the year. In the United States, HMPV infections are most common during the late winter and spring months, often overlapping with flu season. Currently, we are seeing a surge in HMPV cases across the country. This surge, coupled with the ongoing circulation of other respiratory viruses like the flu and COVID-19, has put a strain on healthcare systems in certain regions. While HMPV is spreading nationwide, certain areas are experiencing a higher volume of cases. These areas often correspond with regions experiencing higher rates of other respiratory illnesses. Factors like population density, vaccination rates, and access to healthcare can influence the spread and severity of HMPV outbreaks. Staying informed about the spread of HMPV in your local area is crucial for taking appropriate precautions. Local health departments and the Centers for Disease Control and Prevention provide up-to-date information on HMPV activity and guidance on protecting yourself and your family. Shielding ourselves, effective protection against HMPV. While there is currently no vaccine specifically for HMPV, there are several proactive steps you can take to protect yourself and your loved ones from infection. Many of these measures are simple yet highly effective in reducing the spread of respiratory viruses. Frequent hand washing remains a cornerstone of infection control. Wash your hands thoroughly with soap and water for at least 20 seconds, especially after coughing or sneezing, before eating, and after using the restroom. If soap and water are unavailable, use an alcohol-based hand sanitizer containing at least 60% alcohol. Covering your coughs and sneezes is crucial for preventing the spread of respiratory droplets. Cough or sneeze into a tissue and immediately discard it in a lined trash can. If a tissue is unavailable, cough or sneeze into the crook of your elbow rather than your hands. Avoid close contact with others, especially those who are sick. Maintain a safe distance from individuals exhibiting symptoms of respiratory illness. If you are feeling unwell, stay home from work or school to prevent spreading the virus to others. Cleaning and disinfecting frequently touched surfaces can help reduce the spread of HMPV. Wipe down surfaces such as doorknobs, light switches, countertops, and electronic devices regularly using household disinfectants. Stay informed, stay healthy, taking action against HMPV. The recent surge in HMPV cases highlights the importance of staying informed about our health and taking proactive steps to protect ourselves and our communities. While HMPV can be concerning, remember that knowledge is power. By understanding the virus, recognizing the symptoms, and implementing preventative measures, we can significantly reduce the risk of infection and its potential complications. Stay updated on the latest information from trusted sources like the CDC and your local health department. Remember, simple actions like hand washing, covering coughs, and staying home when sick can make a world of difference. Let's all do our part to stay healthy and protect those who are most vulnerable. If you found this information helpful, please give this video a thumbs up and subscribe to our channel for more evidence-based health insights. Stay informed, stay healthy.